Welcome to our YouTube channel. Bwembo Elvin on your screen to present you the management of brucellosis. In the recent videos, there is one talking about brucellosis, and in that video we have been able to see the definition, what brucellosis is, what causes brucellosis, people at risk of getting brucellosis, signs and symptoms of brucellosis, and we have been able to see how brucellosis can be transmitted from one person to the other. Today we have come with our management of brucellosis, but before we do any management, we have to do the investigations, and among the investigations we do to rule out Brucella bacteria in our blood and our bone marrow tissue. These are some of the investigations which can be done. We have blood for culture and sensitivity to rule out the bacteria parasites. Then another one, we have bone marrow tissue, so that they rule out the bacteria. And then we have hepatic biopsy. It is the same to rule out bacteria. We have an X-ray of the vertebrae, which will reveal changes in the bone marrow formation, and it will help us in ruling out brucellosis. And the confirmatory test now is BAT, which is Brucella agglutination test. It will help us to confirm that you have Brucella. That is the confirmatory test done. In our treatment, we are going to need antibiotics, and many antibiotics are used in treatment of brucellosis. We are going to need antipyretics for fevers. We are going to need analgesics to kill the pain. For example, in our signs and symptoms, we said that we have headache, that is pain. So these are the drugs we can use in treatment of brucellosis. We have antibiotics like rifampicin, streptomycin, gentamicin, and tetracycline. Those are all antibiotics we can use. Also, we can use doxycycline. In our first line treatment for adults, IM is streptomycin or intramuscular streptomycin 1 gram OD for 14 days. Then you give doxycycline 100 milligrams BD for 45 days. And then, if you don't give streptomycin with doxycycline, you can give intramuscular gentamicin 5 milligrams per body kg once a day for 7 days. Then you give capsules doxycycline 100 milligrams 2 times in a day for 6 months. If you are to treat neurological brucellosis, you are going to use capsules doxycycline 100 milligrams twice a day for 6 months. You use rifampicin tabs for some good 2 weeks. Then add on tablets, Septrin 960 milligrams twice a day for 4 months. That is to adults. Then in the kids, Septrin you can give 480 milligrams of Septrin BD. That is twice a day. Prevention: how can you prevent brucellosis? 1. Boil milk and meat before consuming it. pasteurizing of milk is very important. Quarantining areas where brucellosis is being ruled out, so that the animals from that place can't be transported to the other place. Then we have proper disposal of products or secretions from infected animals. That's it. What are the complications of brucellosis? Now we are going to see complications of brucellosis. One is urchitis, and urchitis, we say that it is inflammation of the testes. Osteomyelitis, which is pus formation in a bone tissue. We have, and that osteomyelitis is common in the vertebrae. Thus we have the other X-ray of the vertebrae. We have abortion, especially in animals, and we have infertility, and lastly is death. Once the disease is not treated, you can lose the life. Like our YouTube channel, subscribe and share to your friends. Encourage them to watch the video. Let's wait for another disease in the coming videos. Don't forget to like, subscribe and share. Happy day.